Bismillah ar-Rahman ar-Rahim. This is the second session. We will go over electronic health record. After discussing the types of data that health informatics deal with, the most obvious and the most spontaneous in thinking is the clinical informatics, the information that are generated from the medical care and the clinical care of patients. So this is the term electronic health record. The term EHR, electronic health record, is the preferred term that we will use throughout this course. There are of course other terms that older terms that are used to describe electronic health record. These are the objectives. We will go through them through this presentation. There are important definitions to differentiate between EMR, electronic medical record, EHR, electronic health record, and PHR, personal health record. This is the exact definition according to the National Alliance for Health Information Technology. Let's read it and make comment on it. Electronic medical record. An electronic record of health-related information on an individual that can be created, gathered, managed, and consulted by authorized clinician and staff within one healthcare organization. So electronic medical record is a typical hospital record that is limited in use to the hospital within the hospital. It is created, gathered, managed, and dealt with by the authorized personnel, by the providers, clinician and other staffs within a healthcare organization. This, by definition, does not include exchange of information. It can be, but by definition, EMR is limited to one institution, one organization. So it is of limited use within the same institution or within the same hospital. Okay, when we talk about electronic health record, EHR, it is an electronic record of health-related information on an individual that conforms to nationally recognized interoperability standards that can be created, managed, and consulted by authorized clinician and staff across more than one health care organization. So EHR, in simple imagination, is more than one EMR. If we have different hospitals, let's say in the kingdom we have like let's say 200 hospitals overall in the kingdom. If the health record is connected, there is exchange of information between health records, this will satisfy the definition of EHR. Of course, it doesn't have to be connected, but it is designed or programmed or capable for connection. So as the definition says, it conforms to nationally recognized interoperability. The term interoperability, it means inter means between, operable between different institutions. So it can operate within more than one hospitals, preferably over on national level, interoperable, that the information can be exchanged in the country all over the place. So this is EHR. A related term, PHR, personal health record. Personal health record is an electronic record of health-related information on an individual that conform to nationally recognized interoperability standards that can be drawn from multiple sources while being managed, shared, and controlled by the individual himself. The individual here means the patient or a healthy person, of course. He can create, any healthy person can create personal health record to follow his health. Or a patient can make a record to follow up his disease or even like healthy behavior. So it is managed, PHR is really managed by the patient himself, by the individual. Again, it is connected, it conform with the interoperability standard, so it is connected to EHR, connected to EMR, but it is essentially managed by the individual himself. This is a picture to give you some visual imagination. EHR is the health record that can be interoperable on the entire national level. So healthcare from primary healthcare, secondary hospitals, tertiary hospitals, they have different systems, but if all systems are connected, now we speak about EHR. EMR is part of EHR, so multiple EMRs will form EHR provided that they are connected. The data can be exchanged between different systems. And PHR is a system that is managed by the person, the individual himself. Okay, let's discuss, imagine what are the main functions of EHR. Let's say a hospital is purchasing a new system from a vendor to transfer all patient record to the new digital system. What are the functions that this hospital is supposed to have within this system? Of course, these are really the main functions. There are 8 core functions of EHR. This is according to the Institute of Medicine Vision. 8 core function of EHR that to call it EHR, you should at least have these 8 functions. The first one, health information and data. Of course, you need the record of the patient, the details of the patient, demographics, history, admissions. This is the health information data. Result management. Not only history and exam, you need to connect lab result, radiology result, any investigation you do for patients, you need your system to connect and to show you the results of the management, of the any management that has been done. Order management. When you order lab work, imaging, pharmacy, medication, orders should be done through the system. Decision support. Decision support is one of the let's say, I would say this is one of the exciting functions of EHR. EHR is not only a system that you can make orders of, let's say we would like to order antibiotics for a patient, and this patient is allergic to this antibiotic. So if within the record it has been entered that this patient is allergic, the system should notify you, at least warn you, notify you, or even prevent you from prescribing this antibiotics if the patient is allergic. At least the system should give you warning and notification that the patient has allergy to this antibiotic. So this is a decision support system. So when you order medication, the system notify you whether there is contraindication or if the patient has allergy to this medication. So this is one of the ideas of decision support system. One of the main function as well, electronic communication and connectivity. We just spoke about the interoperability. So the system of EHR should be connected. And by saying connectivity and communication, emails do not really satisfy the meaning of interoperability. So to make the system interoperable, the information needs to be exchanged seamlessly. It means that the exchange is spontaneous, without really effort or without manipulation of the information. However, if you have system that you need to log in, then collect information and send it manually in one way or another to another system, this is not really interoperable. Although you transfer the information, but it is not really interoperable. Interoperability, it means that the systems can talk to each others, different systems talk to each others, and the information can be transferred without any effort. Patient support. One of the functions of EHR is provide some support to patients. Easy examples is, or typical examples, making appointment booking to patients, showing patient result of blood work or any investigation, providing reports so patient can download and print, make some follow-up suggestions to patients, provide information to patient. So this is all within the patient support function. One of the functions as well, administrative process and reporting. Clinicians are not the only people using electronic health record. So when patient is admitted, there has to be some insurance payment, if the patient is eligible to receive treatment or not, what type of eligibility, what medication he is allowed to do to get, and so on. So the administrative process needs to be connected within the EHR as well. Lastly, reporting and population health. On aggregated level, EHR should have population health data available for analysis and interpretation. So according to the Institute of Medicine, these 8 functions are the main functions of EHR. Of course, this is not these functions are not limited to this list. You may think about more than these 8 functions. Okay, to show you the complexity of the system as EHR, this picture, each item, box, square or shape within this picture represent type of data that are collected to serve some sort of function, and you see how many type of data are included in the picture. This all together, this represent EHR, electronic health record. Let's take examples. For example, in the middle of the picture, you see the core clinical EHR systems. What are the core clinical EHR system? Point of care documentation. So this is really the main thing that comes to mind. Point of care, when the patient has an appointment, visit, or if the patient is admitted. So there is a point of care documentation, history, exam, etc. Then you may order some investigation. So result management is connected to point of care documentation. if you order investigation or you order imaging, you should have clinical decision support system. Clinical decision support system, as I mentioned earlier, it is a system that help you to make the correct action. You at least, for example, it might give you notification, warning, or it might even prevent some obvious errors if from happening. So this is part of the core clinical function. Reporting is another core function. Then the medication management, physician computerized physician order entry or computerized provider order entry. This is you enter really the order for the medication pharmacy. Barcode, medication administrative record, I think, if I'm not mistaken. Barcode, medication administration record. So this is related to the medication. So these are really the core functions of the clinical EHR. Of course, there are specialties, specialty clinical system like intensive care, preoperative surgical, cardiology, labor and delivery, other specialties. This is the ancillary study, the ancillary system, the lab, radiology, pharmacy, dietary. There are also administrative system. There are supporting infrastructure and connectivity systems. All of these are different electronic systems that must work together to form EHR, electronic health record. So now you can imagine the complexity of data and information that we need to work with and integrate to make good EHR. From another aspect of analysis or another aspect of looking at EHR, this should be, sorry, this is spelling mistake, EHR. We can think of EHR as a system that we need to implement in a given organization. Let's say you have a hospital and you are leading a team to implement a new electronic health record in the system, in the hospital. What are the components that you need to consider when you implement EHR within a hospital? This slide summarizes these components. You need hardware. Within the hospital, you need computers, network, connectivity, devices, maybe wireless connectivity as well. So this is the hardware that you need within the hospital. You need software. You need the system, the programmed system that you install on computers and devices, so you work on. This is not the only component. This is the main point of this slide. Hardware and software are really part of the system. By themselves only, you cannot really say that you have EHR working. You need to get people involved. So to create a system that EHR works well, you need hardware, software, and you need people to support the use of the system, and you need the correct policies within the hospital that drives really the adoption of the system, and you need to change the processes. Most of the time, implementing systems like EHR and digital system will result in change in the workflow. So people, they do work in a certain way, in steps from 1, 2, 3, 4. Then if you implement a new system of electronic system, most likely you will change the workflow. They will not do the work as they used to do. So you need to create a new process. So when you implement electronic health record, it is not only computers and software. This is the main point of this slide. You need to consider people, policy, and process within the system. In other words, electronic health record are techno-social system. It is not only technical. You need the social aspect of it as well. Okay, enough about EHR. Let's broaden our talk about data and speak a little bit about the term big data. The term big data has been used lately in the last few years. From the name, I suppose you can understand that big data, it means something huge, a huge amount of data that we can capture and store, and probably we make use of it. This is the main point. Do we use it? Is it useful to collect this huge amount of data? So by definition, big data, this slide summarizes V's, 6 V's of big data. The first criteria or the first feature of big data is value, clinically relevant data, volume, high throughput technology. So you have a large volume of data that you are collected. Velocity, these data are aggregated quickly by the second. Every second you have some form of data that are collected. They are coming from variety of sources, not only one source. There are different sources that you collect. Veracity, it means the quality, the data quality is variable, and it might be unreliable. Data coming from uncontrolled environments. Variability, seasonal health effect and disease evolution. So these really, these V's summarize what we mean by big data. Big data is collection of huge volume of data in high velocity from variety of sources with different reliability of the sources. So if you collect this information from these different sources, we call this big data. Let's imagine that in addition to the health record of a person or a patient, you are collecting, for example, his social interaction on social medias, what he's interested in, what he's not interested in, and you collect also, for example, his activities, sport activity, other activities. So you might end up with huge amount of data that can be used to be relevant for health. So this is the term big data. Okay, let's move to another term that is important to us here is the term personalized medicine. Really, personalized medicine is modification of a standard management, treatment, or medication or procedure to fit a person in particular according to his features. So it is defined, personalized medicine has the potential to tailor therapy with the best response and highest safety margin to ensure better patient care by enabling each patient to receive earlier diagnosis, risk assessments, and optimal treatments. Personalized medicine holds promise for improving healthcare while also lowering cost. So if we have data about people, you can tailor the management to fit their characteristics, and you don't waste their time and effort. You give them the best for them. This is the term personalized medicine. So how do we do it? How do we do personalized medicine? You need to collect information from different sources and to use it to fit the patient's need. With this, I end this talk, and in our meeting session, we will go over the assigned task as well. Thank you very much. You can look at the references as well, check the material in the references. Thank you.